No more bipolar disorder. Bipolar disorder (BPD) refers to a disease characterized by repeated episodes of mania, hypomania, and depression, with the first episode occurring at any age. There are two main subtypes of BPD. BPD-I refers to patients who meet the criteria for a manic episode and experience severe depression during the course of the disease, and BPD-II refers to reports of at least one severe depression and at least one hypomanic episode in a lifetime. Although BPD is more common in young people, 25% of BPD patients are over 60 years old, and about 10% are over 70 years old. The incidence of BPD in the elderly is about 0.5%-1.0%. 10-25% of the elderly suffer from mood disorders. The patient's mood is sometimes agitated and sometimes depressed, and he or she has symptoms of depression and mania. The course of the disease is variable and complex. The interval period may be long or short, which may affect social function. After repeated episodes, the frequency of attacks is fast and the condition is more complicated. The possible causes of this disease are as follows. 1. Abnormal function of central neurotransmitters. 2. Changes in the hypothalamus-pituitary-adrenal axis and hypothalamus-pituitary growth hormone. 3. Genetic factors are the main risk factors for patients, and patients with bipolar disorder have obvious familial clustering. Genetic tendency surveys have found that the probability of inheritance of this disease is 85%. 4. Pregnancy and delivery problems, mainly including low birth weight, premature birth, hypoxia and asphyxia at birth, maternal infection during pregnancy, and father's age is too old. 5. Environmental factors will aggravate symptoms or cause the risk of schizophrenia, mainly including loss of relatives, loss of job or home, divorce, broken love, physical, sexual or emotional abuse. Drug abuse, or taking psychoactive drugs during adolescence, youth or adulthood. People with schizophrenia may have experienced the above before and during birth, and these factors will have subtle effects on brain development. Patients will have typical symptoms such as hallucinations, delusions, confusion, abnormal behavior and thoughts. Not only that, this disease seriously affects the patient's social life function, sometimes showing manic symptoms and sometimes showing depressive symptoms.